Hi everyone, in today's video we're going to take a look at the anatomical adaptations that allow for fetal circulation. And this is going to help us later on when we take a look at what has to change as the newborn transitions from fetal to adult circulation, and then also some insight to complications as they can often involve these adaptations. So what's going on inside there? I'm Mark, let's take a look at it. Our first adaptation, the placenta, literally the physical attachment between mom and baby. Inside the uterus, the placenta is attached to mom. On the other side of the placenta, it forms the umbilical cord, and this goes off to baby. Now, look at how vascular this placenta is. Later on, you think about an abruptio, or if this placenta becomes detached from the uterine wall, how much bleeding can occur? It's very vascular. Something to think about, and we'll talk about in complications later. But you can take a look at the size and the vascularity of this placenta. Next adaptation, the umbilical cord. Literally, it has 2 arteries and 1 vein. Now, back in the day, Saturday Night Live, there was a character called Mr. Bill.
Time for the Mr. Bill Show!
And it was a little clay animated character, and every week he would succumb to some horrible event and he'd go, "Oh no!" and he'd have this big mouth.
He says that dog looks mighty tasty.
If you dissect the cord, it looks just like Mr. Bill's face. The umbilical catheter goes in Mr. Bill's pie hole. Done. He's an endeared character. The gingerbread man from the Shrek movies, homage to Mr. Bill from Saturday Night Live. And now he's just showing us where to put an umbilical catheter.
Start talking.
Next real adaptation, we have to take a look at the umbilical vein. It's the umbilical vein that carries the oxygenated blood from mom to the baby. Now, remember, as soon as the umbilical cord hits the body, those arteries and veins split in different directions. The umbilical vein is going to go upward, and it's going to go up toward the liver. And it's going to take a shortcut through the liver via the ductus venosus. So it goes into the liver, and it really doesn't mess with the liver because it's all high pressure, but it takes a shortcut to the very low pressure inferior vena cava. So it cuts right through the liver, through the ductus venosus, another adaptation, and goes right to the liver. So now I got this oxygenated blood taking a shortcut through the liver to the inferior vena cava. It's coming up through the inferior vena cava, it's going into the right atrium, and I have my next adaptation, the Foramen Ovale, which is a one-way valve between the right atrium and the left atrium. So now this blood shifts through this opening, through the Foramen Ovale, into the left atrium, where it is now coming down into the left ventricle, and then up and out through the aorta to the rest of the body. So that Foramen Ovale, one-way valve in between the right atrium and the left atrium. Next adaptation, the ductus arteriosus. Remember, as this oxygenated blood comes into the right atrium, it's going to go down to the right ventricle, where it's going to get pumped up into the pulmonary artery to the lungs. Except the lungs have very high resistance. Why? The hypoxic pulmonary vasoconstrictive response. The vessels in the lungs will dilate if there's oxygen in the alveolus. But there is no oxygen in the alveolus, there is only fluid. No O2, no vasodilation, so we have very constricted pulmonary vasculature. It's not closed off, there's still flow, but it's so low it doesn't do anything. So I have very high resistance there. So now as the blood's coming up that pulmonary artery, it can't get into the lungs. Where's it gonna go? Through our next adaptation, the ductus arteriosus, which is a little connection between the pulmonary artery and the aorta. So this oxygenated blood can get through there and then back out to the body. Okay, last adaptation, really, the umbilical arteries, part of the umbilical cord, but really these don't come into play till way down the aorta. Remember, you have blood coming around the aorta, comes down to the femoral arteries, they bifurcate, you got your common iliac arteries coming off of that, and from there, that's where the umbilical arteries are connected, and from there they'll carry deoxygenated blood back to the umbilical cord and back to mom. Now, when you think about lungs versus placenta and oxygenation. Remember that the lungs, very high vascular resistance, very high pressure, can't get blood through it. Placenta, very low pressure, blood wants to go through it, and that's where the blood oxygenates, gets rid of the CO2, and delivers fresh nutrients back to the fetus. This has been a brief summary of the adaptations necessary to support fetal circulation. I'm Mark, thanks for watching, see you in the next video.